All right, I think we should go ahead and get started. Welcome, everyone. Thanks for joining us. I want to note that we are recording this webinar so that folks who couldn't be with us today have a chance to view it later. So my name is Carrie Amaro, and I'm the PACE Director at the Department of Social Services. I'm new here, but there's been a team of folks working on PACE for a while, and I'm thrilled to have the opportunity to join them and to help launch PACE in Connecticut. So thanks for being on. Next slide. So we just need to mention up front that the Rural Health Transformation Project is funded by the Centers for Medicare and Medicaid Services. Next slide. So we wanted to show you how PACE fits in with the Rural Health Transformation Project, which is we use RHTP is the acronym. So the RHTP is a $50 billion initiative nationally. It's funding all 50 states to invest in rural health care projects around the country. Connecticut was awarded $154 million for this first year, and then it'll go on for 4 more years after that, and we're not sure about the funding levels, but hopefully it'll be within that range. So in Connecticut, we organized the Rural Health Transformation Project into 4 initiatives, which you can see here: population health outcomes, care transformation and stability, workforce, data. And the Program of All-Inclusive Care for the Elderly, PACE, is part of the Care Transformation and Stability Initiative. But if you're interested, there are some other projects here that are specifically designed for older adults and people with disabilities. For example, under population health, there's a Promoting Healthy Aging Through Exercise initiative. There are access mental health programs, and data and technology, bridging the digital divide targeted towards older adults. So PACE is just one of several that affect this population. Next slide. So just to level set, I wanted to explain a little bit about what the PACE model is for anyone who might not be familiar. It's a home and community-based services program for people who need long-term services and supports, who are age 55 and older, and who are eligible for nursing home services, meaning they have a significant level of need for personal care and health care, but they want to stay at home, so they want to age in place. So PACE is both a health provider and a health plan. One PACE organization will be selected by the state to provide almost everything directly, but also to manage and pay for services that are delivered by contracted providers. So the PACE organization is paid a set amount each month per participant, and then they take on all of the responsibility as well as the financial risk for providing all of the services that the participants need. And the program provides all medical and social services. So it's a really wide range of things that allow people to live and thrive in their homes and communities. So if you're interested in learning more background, the National PACE Association has a lot more information about the model, and I've got their website there. So next slide. So where are people in the PACE program served? They're served primarily at the center. That's a key part of it. So it's a physical space, and people who live in a limited geographic area will be eligible for the program and will get a lot of their services at that center. The service area has to be small enough so that participants don't have to travel more than about 45 minutes or an hour to get there from their homes. And so they'll get a lot of services there, but anything that they can't get there from specialty providers or other things they need, they can get in the community, and transportation is also provided for that. And then in addition, they can get services at home depending on their level of care and what their specific needs are. They can get skilled nursing care, personal care, and all other kinds of supports that would help them live comfortably and safely at home. Next slide. So PACE has quite a long history. The very first program was launched in San Francisco in 1971, and there's been a lot of research. It's been very well studied over the years and has shown really positive outcomes for people in terms of their physical health, people's mental health and also quality of life, and reductions in healthcare utilization, especially hospitalizations and nursing home stays. So because of that research foundation, it was authorized by the Centers for Medicare and Medicaid Services as a provider type in 1997, and it's been replicating across the country now for a while. So there's been a lot of interest in PACE in Connecticut for many years, and the legislature authorized establishing PACE in 2023, and then it was written into the Rural Health Transformation Project. So I just want to note that PACE was not designed to be like specifically, explicitly a rural health program, but we know that older adults and people with disabilities who live in rural areas often have particularly hard challenges to face in terms of getting the services they need, getting to them, and transportation. There are workforce shortages, and sometimes these are worse in rural areas than in metropolitan areas. So because of those barriers, it seemed like a wonderful fit to start a PACE program in a rural area using this Rural Health Transformation Program. So next slide. So what will this mean in Connecticut? So PACE will be a new service option for people who need long-term service and supports. It's voluntary, which means no one will be automatically enrolled. Individuals will have the opportunity to learn about it and weigh the pros and cons and think about whether it meets their needs, and then they can decide to enroll if they want to. We think it could fill a really important gap in services for people who are 55 to 64 who aren't eligible for Medicare yet necessarily. And we anticipate that it will most likely serve people who are on both Medicare and Medicaid. In most other states, the vast majority of PACE participants are dually eligible for both of those programs, and we think that will be true here. People who are dually eligible for Medicare and Medicaid have some of the highest levels of need and face a lot of challenges. And PACE is really one of the most seamless ways to integrate both the Medicaid and Medicare funding streams. So it could include people, like I said, who are already on both programs. It might include people who are not enrolled in either of those or in any public program, but if they meet the level of need for nursing home care and are financially eligible for Medicaid, they could enroll. And then there might be people who are already getting long-term services and supports through another public program, through Medicaid, like the Community First Choice program or the Connecticut Home Care program for elders. But if those folks live in the service area for PACE, then they could potentially decide that PACE is a better option for them. So the planning to date, the state conducted a feasibility study in 2024 and 2025, Myers and Stouffer conducted, and that final report is available online if you haven't had a chance to look at it. And that identified certain areas of the state where PACE could work well, and a lot of discussion there about the pros and cons, but really found overall that PACE would be feasible in Connecticut in several different areas. What we've been doing since then is talking to stakeholders, thinking about design, development, how it would be evaluated. And we've tentatively selected these 27 towns in the Northwest Hills region to be the pilot service area. So we had proposed to CMS and the Rural Health Transformation Project to initiate in the Northwest Hills, and it looks like a combination of zip codes from these 27 towns would make up a service area that would be both big enough to have enough enrollees to make the program viable, but also not put any participant too far away from the physical center. So next slide. So I wanted to go over the timeline, and just to note this is tentative. We're continuing, like I said, to engage stakeholders. That's going to continue. We're particularly focused right now on hearing from people in that Northwest Hills area, older adults, people with disabilities, people who need long-term service and supports, and who might be a participant, as well as health and social service providers in the area, policymakers. This is a really well-established and well-researched model, like I've said, and many of the program elements are fixed. They're set at the federal level. But we do have some flexibility, and we want to make sure that we identify any additional program features or variations that we think will serve Connecticut well, for each for the local area where it will be launched. So there may be some special organizational capacity that we would want a PACE organization to have in order to meet the needs of that area. For example, responding to the challenges that are maybe unique to that area or the cultural backgrounds of the people who live there, or there might be service needs that are missing there that need to be filled. So if you look at the feasibility study, they documented specific challenges for older adults in Connecticut, but particularly around the cost of housing, which could make it difficult for someone to stay at home, even with a program like PACE supporting them. So in some other states, we know that PACE organizations have incorporated, housing navigation or support for their participants. There are also transportation challenges and workforce shortages in the state, especially in those rural areas. So these will also need to be considered. And then there was also quite a lot of feedback as part of the feasibility study from stakeholders that is a lot of unmet need among older adults for behavioral health. So we'll be thinking about all of that as we're talking to stakeholders and drafting a request for proposals for the PACE organization that will be looking to find an organization that can meet the capacity that we're looking for. So we'll incorporate all of the federal requirements, but then also this unique state vision into that. And we expect to release that RFP later this fall. It'll probably be late 2026. It could possibly be early 2027. I can't give you an exact date right now, but then we hope very shortly after that, likely early 2027, we'd be in the position to actually select the single PACE organization. And then the real work begins. So that PACE organization and the state will need to spend a lot of time getting ready, preparing. So the evidence from other states indicates that, there's a lot of deliberate planning and there are a lot of approvals that need to happen to make PACE successful, and it takes time. So over that next year in 2027, we'll be working to get the physical center ready. The PACE organization will need to hire staff and make sure they have the interdisciplinary team that is required as part of the PACE model in place. We'll be working to educate partners and educate providers who would likely be referral sources for PACE to let people know about it as an option. And then, certainly working with, organizations in the area to understand the program and to help point people in that direction if it looks like it's a good fit for them. So that includes, working with area agencies on aging and centers for independent living, the DSS access points. And then when all of that is ready, the state will complete a readiness review. That's after we've gone through the preparations. There are some applications and approvals that need to happen with CMS. And then we expect that PACE enrollment will begin in 2028. We think maybe spring or early summer, we hope. And that's still a ways out. But like I said, there's a lot of work that needs to be done in between now and then. And we look forward to hearing from you all as stakeholders through some of our engagement. We'll be having events like this, probably site visits and stakeholder meetings. And so keep an eye out for opportunities to talk with us about what you think PACE should look like in Connecticut.